Welcome everyone to our Lown Weekly Women's Webinar. I am very excited about the talk today and am so pleased to be introducing Dr. Supriya Rao, who's a gastroenterologist and also obesity board certified and runs the medical weight loss program at Integrated Gastroenterology Consultants. And she is joining us today to give an overview of gut health and talk about the gut microbiome. So this is exciting for us because this is an area that the research has really taken off in the last few years and will be really informative for all of us. So as we get started, I just want to remind everyone to submit your questions and answers through the Q&A. And following Dr. Rao's lecture, we'll help to moderate a question and answer and hopefully have a nice little discussion. All right, Supriya, thank you.
Thanks so much, Allison. I really appreciate it. It's great to be here. I don't know, every so often my screen is freezing, so I hope that doesn't happen too much as we go on, but we'll see how it goes. So the talk I'm giving today is on gut health, motility, and the microbiome. So just a little bit about me. I'm a managing partner in my GI practice, Integrated Gastroenterology Consultants. It's located in Chelmsford, just about 30 minutes north of Boston. I'm also director of medical weight loss at Lowell General Hospital, board certified in internal medicine, gastroenterology, and obesity medicine. And I'm also part of the physician-led advocacy group in Massachusetts called the COVID-19 Action Coalition. We've been doing a lot of work since the pandemic has started in terms of advocacy, just kind of evidence-based stuff to help people during the pandemic. So it's been kind of a really great thing to be involved in. A little bit more about me. I'm a mother of two. They just started school, so it's been kind of a crazy time in the house right now. And my practice is very busy. We have 6 gastroenterologists currently and 4 nurse practitioners, and we cover quite a large area in the Merrimack Valley, including the Lowell area, as well as extending out to Lawrence as well. So it's a really great population to be taken care of. My husband is in my practice as well. He's a gastroenterologist, so we talk a lot about GI at home. My kids have heard quite interesting discussions that we've had, and they think everything is about poop. So it's fun to have that. My passion in my work is to help patients with their GI issues and to promote a healthy lifestyle to avoid chronic medical conditions. I see patients from the age of 18 to past 100. So it's quite a span. And for me, seeing the younger patients and trying to get them to start thinking about their health at a younger age to avoid issues later in life. I love being outdoors. It's a beautiful day today, and to exercise, especially out in nature. And I'm a big foodie. I love to cook at home and get my kids involved in the process. So that's just a little bit about me. Just a quick disclaimer, this presentation is for patient education. This is not direct medical advice, so any specific personal medical issues you may be having, I will direct you to your physician to discuss with. And my goal of this talk is to basically have you be feeling informed and empowered about your health. And I'm also a consultant in a small GI startup, so it's just kind of my disclaimer. All right, so I just want to give a quick outline about what we will be discussing today. So the first thing is, what is the gut microbiome? What kind of diet and lifestyle changes can you adopt to optimize your gut health? What is gut motility and why is it important? And what are some signs and symptoms of altered gut motility? And when you're thinking about this, you may be thinking, oh, I'll just have some issues, maybe I can take care of it on my own. But then when should you really think about seeking medical attention? What kind of evaluations would be recommended depending on the symptoms that you're having? So first, let's just discuss what the gut microbiome is. It's a huge field that's gaining importance year by year, lots of research going on as we speak. The term gut microbiome wasn't generally thought to be recognized to exist until the late 90s, so it's really quite a new field. So the human microbiome is a highly complex community of microorganisms that are present in the small bowel and the colon. And when I say microorganisms, it's not just bacteria, but also viruses, parasites, and fungi that are present. The microbiome consists of about 100 trillion bacteria the number of genes in the microbiome far exceeds the number of genes in the human genome. So there's a lot in there. And it weighs about 5 pounds. And there are about 1,000 to 1,200 species of bacteria present in the microbiome. And what is the importance of this? Well, the microbiome is important in vitamin synthesis, so it helps to make our B vitamins and vitamin K. It's important in digestion and carbohydrate fermentation. We'll discuss a little bit more about what that means for our body. And it influences the development, maturation, and regulation of the immune system. So the immune system plays a key role, and the gut microbiome is key in maintaining a healthy immune system. And it's now almost thought of as a supporting organ in a sense, just like the heart or the lungs, just in terms of how the kind of importance that it carries. So the origin of your microbiome, where does it come from? How do we even know about it? So if you're first exposed to the different types of microorganisms as an infant during delivery and via your mother's breast milk, and initial exposure is obviously then determined by your mother's microbiome. As we get older, environmental exposures and diet influence the microbiome over time. So the kinds of foods you eat, where you live, those kinds of, eventually, when you have kids, all of this kind of influences the microbiome over time. And most of the organisms that are present are symbiotic, meaning that you gain a benefit from them, they gain a benefit from you. But obviously there are some that are pathogenic. But in a healthy individual, all the microbiota coexist peacefully. And then a disturbance can cause what's known as dysbiosis, which is kind of a disruption in the microbiome, increasing risk of disease. And when I mean disturbances, this can be any kind of infection, certain types of diets that you may be undertaking, certain medications or antibiotics, or any other kind of traumatic event that can cause a change in the microbiome. And this can increase our risk for disease. So microbiome and immunity. So just thinking about this, it's very essential for human development and immunity. And the gut is actually a major site of immune activity and production of antimicrobial proteins. About 70 to 80% of the body's immune cells are actually present in the gut. And diet is a key influencer in this case. And so the helpful strains of bacteria, the helpful microbes, break down foods that we eat that are fiber rich into a compound called a short chain fatty acid, which then stimulates further immune cell activity. So as long as we continue to eat a diet that's rich in fiber, we're gonna be helping our immune system. And again, disruption of the microbiome can lead to certain autoimmune conditions, especially at a young age. So if you're small and get quite a bit of antibiotics at a young age, there has been some research that does show some possible correlation with diabetes, rheumatoid arthritis, celiac disease, IBD like Crohn's or ulcerative colitis, multiple sclerosis, fibromyalgia. So these are all possible kind of autoimmune conditions that can occur with the disruption of the microbiome. So this is just kind of like an equation that I think is really important. So, and we're actually, when we talk about this, we're gonna kind of go out of order a little bit, but the way I like to think about our gut health is that prebiotics plus probiotics will then yield postbiotics. And so what does this mean? So prebiotics are the foods that we eat that kind of help feed our gut, which contain probiotics, or probiotics are the helpful bacterial strains that will eventually produce postbiotics. Postbiotics are the substances that will help our body. And so let's talk about the postbiotics first, actually. So a postbiotic that is really important in our health are these short chain fatty acids, specifically acetate, propionate, and butyrate. And when these are produced in the gut, they reduce the pH to suppress the growth of harmful bacteria. They inhibit inflammatory agents like interferon gamma and TNF alpha. You'll see a lot of those kind of inflammatory markers present in autoimmune disease. They are the primary energy source for the colonocytes, or the lining of the colon. So when they're the primary energy source, they end up improving the gut barrier and decreasing endotoxin release by the bacteria that are present, the pathogenic bacteria that are present in the gut. This also helps to promote intestinal motility. It's protective against GI cancer, specifically colon cancer. There has been shown research that it does improve blood sugar regulation. Short chain fatty acids also promote the release of satiety hormones, specifically GLP-1 and peptide YY. So there are certain receptors that are present in the colon that get activated by short chain fatty acids, and then GLP-1 and peptide YY are excreted. They do have a role in the prevention of atherosclerosis. So this is kind of the cardiology link. They limit endotoxin release because they are, again, reducing the pH of the gut. They're promoting the intestinal integrity. So less endotoxin is being released. There's less leaky gut. And so there's less vascular inflammation. And there have been some studies to show possible interaction in cholesterol gene expression, which can then lower cholesterol in patients. Oh, and short chain fatty acids are not found naturally in foods, and so they must be produced in the gut to confer any sort of benefit. So if you see a supplement that says they have short chain fatty acids in it, do not buy it, because by the time it gets down to your colon, it's already been dissolved by your stomach acid, so it won't be helpful. You need to be able to make these in your colon for it to be helpful. So this is a helpful postbiotic. What is not helpful? So this is trimethylamine N oxide, or TMAOs. And so this is produced in the gut when you have dysbiosis or there's disruption in the microbiome. And we know there are several studies that show that TMAOs increase the risk of cardiovascular disease and all-cause mortality, specific increase risk in MI and stroke, they think, because of the increased inflammation that's present. So foods that are rich in L-carnitine and certain choline, so specifically high-fat dairy, processed meats, red meats, and certain nutritional supplements and energy drinks are rich in these particular substances. And so these, when they enter our gut, they interact with the pathogenic bacteria in the gut to then produce TMAOs, which have all these negative downstream effects. So let's go to another part of the equation. So these are probiotics. And so probiotics, it's such a buzzword as well. And the probiotic industry is multi-billion dollars. So let's talk a little bit about them and what they mean. So probiotics are microbes or organisms that are naturally occurring in foods, either inside our colon or isolated in supplement form, or, like I said, occurring in certain foods. And the supplement industry is a multi-billion dollar industry. And so there's been a lot of data to say, everyone you talk to, I see patients in the office, they say, oh, should I take a probiotic? Align, Culturelle, all of these are kind of marketed heavily in the press. And so how do we ensure we are, taking in the right probiotics? Should we even be taking a probiotic? And so the problem with the supplement industry is that it's not regulated by the FDA, so you don't necessarily know exactly what you're getting. And they're only really helpful, and the AGA, our major GI society, says specifically in preterm birth and in inflammatory bowel disease like Crohn's or ulcerative colitis has actually been proven to be helpful. In a general population, they're actually recommended against the use of the probiotic supplements in most conditions because there just isn't great evidence to show that they confer a benefit. And they can be actually very expensive as well. So in general, we don't recommend them. There are some patients I do recommend if they have severe IBS and are willing to try different things and willing to try a probiotic. But in general, I think more research is needed, especially in patients who are on chronic antibiotics. But I like to think that it's best to obtain most of your vitamins, minerals, and benefit from the food that you're eating. And so these are certain foods that that are rich in probiotics. So sauerkraut, kimchi, miso, yogurt, all of these are healthy foods that have fermented properties and end up having a lot of probiotics in them. So this is much better because with the fermented food as opposed to the supplement, you're getting, not only are you getting the probiotic part of it, but you're also getting the prebiotic fiber, vitamins, and other benefits from the food. So what are our helpful probiotics? So kind of the major strains that are the most helpful are the lactobacilli, bifidobacter, prevotella, and faecalibacter. And these are the ones, the helpful strains that ferment the prebiotic foods to release short chain fatty acids to help heal the gut and improve the immune system. And which are the harmful strains? So specifically E. coli, Clostridium species. You may have heard of the infection C. diff before. So that's a pretty pathogenic bacteria which causes severe diarrhea and inflammation in the colon. Bacteroides, Propionibacter. So again, when foods containing L-carnitine or very high levels of choline are ingested, these bacteria produce the harmful TMAOs, which have cardiovascular and neoplastic side of downstream effects. So we can talk a little bit about prebiotics. And so this is the first part of the equation I showed you earlier. So prebiotics are the foods that are selectively utilized by microbes in the gut and confer health benefits. So if you think about these, they travel through our intestines, and only in the colon do they start getting used and fixed in terms of making these short chain fatty acids. They're often rich in fiber, but they can also contain resistant starches. So foods like oats, rice, potatoes, certain lentils and legumes, they may not have as much fiber as other foods, but they have a lot of the resistant starch, which allows the bacteria in the gut to ferment and produce the short chain fatty acids. They affect the type and the amount of our microbiota. So if you can imagine, if you are able to feed your healthy bacteria, those healthy bacteria are going to multiply and grow and end up kind of downstream creating more of the short chain fatty acids and better downstream effects. Again, dietary fiber, short chain fatty acid, lowering colonic pH and limiting the growth of our harmful bacteria. If you all of a sudden decide to eat a lot of prebiotics at once, you think it's oh, you're jumping on the prebiotic train. Side effects of sudden introduction can include increased gas and bloating. So I always tell my patients to gradually add it, because you're going to have a lot of side effects and then kind of stop doing it. So just make sure you're adding in the foods gradually, or a fiber supplement gradually, in order to have less of the GI side effects. So again, how does diet affect the microbiome? In my opinion, having foods that are high in pre and probiotics are key for gut health. A diet that's high in variety, specifically plants, fruits, vegetables, whole grains, and legumes, which are our prebiotics, support the growth of beneficial microbes. So this is basically looking at the Mediterranean diet, leading to the production of short chain fatty acids, whereas the Western diet that's high in refined sugar, ultra processed, animal sources of protein, high levels of that can promote disturbances resulting in chronic inflammation that's been shown time and time again from the production of TMAOs. So why is this important? You know, we think about now in the US and kind of in Western countries, we're living longer, but then ending up like the latter couple decades being on a lot of medications and having chronic medical issues. I started getting interested in learning more about the blue zones in the last couple of years. And so these are areas around the world, 5 specific areas around the world where people are living into their hundreds routinely. And there was a study done back in 2012 that was looking into these specific populations. So there's an area in Costa Rica, Sardinia in Italy, Greece, Okinawa, Japan, and Loma Linda, California, where the Seventh-day Adventists are. And so they looked at all these different populations and are trying to get a sense of why are people living well into their 90s and 100s here. They don't seem to be on much medication. What is it about their environment? And so this Blue Zones project kind of started up and looking more into it. And what they found about these specific areas around the world is that there is a significant amount of centering on the family, a lot of social support, a lot of social engagement, whether it's faith-based or other, just people are there kind of supporting each other. It's a very plant-centric diet. So even if there is meat consumed, it's in small amounts or used for special occasions, but the majority and the focus of the meal is plants. Moderate, regular physical activity, especially out in nature, is really important. So being outside, getting physical activity every single day, if possible, even a 30-minute walk is important. The amount of alcohol that they take in is in moderation, little to none in some places, but in Italy, for example, they have, moderate amount of red wine that's ingested. Low stress levels. Overall, people are able to manage their stress via yoga or meditation, or again, good social support, and getting adequate sleep, 7 to 9 hours of sleep per night, which is something I think that a lot of us can say that we don't get, but as we know, there are a lot of studies that show that your sleep is one of the most important things, and getting good uninterrupted sleep is extremely important for all-cause mortality. So, we talked about having good gut health and a healthy microbiome. They contribute to processes all over the body, including immunity, vitamin synthesis, avoiding this autoimmune conditions. And the brain-gut axis is increasing in importance. And so the gut is almost thought of as a second brain, because the microbiome is able to secrete neurotransmitters like serotonin and dopamine, which then have downstream effects on not only your mood and stress, anxiety, depression, but also on motility. And so having a healthy gut allows for nutrients to be absorbed optimally, toxins eliminated, and our gut motility plays a large role in how this plays out. So what is gut motility exactly? So it's defined as the movement of the digestive system and transit of the contents within it. So when your muscles, when you may feel your muscles moving around or your intestines moving or noises that it makes, that's all normal. It's just basically the stretching and contraction of the muscles in the GI tract moving the food forward. These synchronized contractions are called peristalsis. And it's important to have good motility to allow for proper absorption of the nutrients that you're taking in. And when the muscles and nerves don't have the usual strength and coordination, this can result in motility disorders that affect your quality of life. So even though structurally everything may appear normal, you may get a colonoscopy or a CAT scan, everything looks normal, the motility is causing a lot of quality of life issues and the function is not normal. So when you think about motility disorders, it basically spans all the way from the esophagus all the way down to the pelvic floor. And so I take care of patients who have all these issues, and I do a lot of the motility testing here in our office and in the hospital. So when you're thinking about the esophagus, a lot of people have acid reflux issues or difficulty with swallowing, and those specific swallowing issues are like achalasia or spasm of the esophagus, which can cause chest pain. In the stomach, delayed gastric emptying or gastroparesis, rapid gastric emptying or dumping syndrome, often seen after gastric bypass surgery, dyspepsia, which is kind of like generalized functional abdominal pain, or cyclic vomiting. And these three are going to be the ones that I'm focusing more on for this talk. But in the small bowel, small intestinal bacterial overgrowth, or SIBO, I think a lot of people have heard about that at this point. In the colon, just constipation, diarrhea, irritable bowel syndrome. And for the pelvic floor, incontinence and pelvic floor dysfunction. So like I said, I'm going to be concentrating on these three mainly. So what are the signs and symptoms of motility disorders? Definitely the sensation of feeling full easily. The food's just not emptying out from the stomach. So you have this, what's known as early satiety. Nausea, sometimes vomiting. It's just things aren't moving the way they should be. Abdominal pain or discomfort. A lot of bloating, gas. I have a lot of people who take pictures coming in showing me that they feel like they're 9 months pregnant, or they start off the day, they're okay, but as the day goes on, they have a lot of bloating and gas. Constipation, diarrhea, and incontinence. Warnings, kind of red flag or warning signs that to be worried about. If you ever have anything like rectal bleeding or weight loss or true difficulty swallowing, those aren't really in terms of motility disorders. Those are more red flags, and make sure you talk to your physician about that to get an evaluation for that. So what are some causes of gut motility disorders? So lots of different reasons, including medications such as opioids. Opioids are very constipating. Metformin can give you diarrhea. PPIs like omeprazole or Prilosec, Prevacid, Nexium, they can also give you diarrhea. Certain antidepressants can do both. Antihypertensive medication, iron supplements can really cause a lot of constipation. We have patients who are on iron supplements for anemia and have a really big issue with this, so they end up getting iron injections. And magnesium can cause diarrhea. Certain infections, especially when travelers diarrhea, food poisoning, the C. diff infection that I was talking about earlier can cause gut motility disorders. Inflammatory conditions such as celiac disease, which can cause both bloating as well as diarrhea, Crohn's and ulcerative colitis, and just kind of run-of-the-mill like microscopic colitis. Surgery such as gastric bypass or bowel resections. Anytime you have a surgery, you always want to think about small intestinal bacterial overgrowth, or SIBO. And then any certain medical conditions, diabetes and obesity are definitely ones where motility can be altered. So let's talk a little bit about SIBO. So SIBO occurs when the colonic bacteria start to reside in other parts of the GI tract, specifically the small bowel, and they grow unchecked. And so this can cause increased gas, pain, diarrhea, constipation. Very rarely can you see weight loss or iron deficiency anemia with it. And risk factors with this, and like I mentioned, anatomic abnormalities. So if you've had surgery like gastric bypass, certain medications if you've been on antibiotics for a while, and medical conditions like diabetes, lupus, or scleroderma that slow down your motility. And so if you're have this stasis of bowel contents just not moving along, then you can have a buildup of colonic bacteria in the small intestine. This is diagnosed with a lactulose breath test. And so what happens is you swallow a drink with this sugary substance called lactulose, and you breathe into a balloon every 15 minutes for a few hours, and that sample is collected and then evaluated for and tested for hydrogen and methane. And depending on the levels that you may have, you'll get a positive test. And so how do we treat SIBO? So you want to be able to kind of get that colonic bacteria in check. So you use antibiotics. You want to correct the underlying conditions. So for example, if your diabetes is really out of control, your hemoglobin A1C is really high, you want to be able to correct the diabetes, get your blood sugars under better control. If you're on certain medications, you want to be able to stop those. And then, diet adjustments as well will help with SIBO. But SIBO is one of these things that can be really tough because a lot of the symptoms that are experienced with SIBO, including the gas, the bloating, and the constipation, can cross over to IBS. And so there's a lot of overlap with a lot of these syndromes. So it's important to speak with your gastroenterologist about all of these. So like I mentioned, so irritable bowel syndrome. So IBS is a term that's thrown around quite a bit by everybody. And so it's really important to know what exactly it is and make sure, do you actually have these symptoms? Do your symptoms actually mean that you have IBS? And so in Rome, there's a group of gastroenterologists that get together and discuss IBS. And so basically on the last iteration of this was Rome 4. And per the Rome 4 criteria, IBS means that you have recurrent abdominal pain that occurs for at least 1 day a week for the last 3 months, with at least 2 of the following conditions of either the pain is related to defecation, you have a change in stool frequency, and a change in stool appearance. And it affects anywhere from 25 to 40% of the population. And the direct and indirect costs can be up to $20 billion a year for IBS. And this means that not only the healthcare costs associated with it, but also just the lack of, not being able to show up for work. We have a lot of patients who call out because they're just having so much pain and can't go to work because of their symptoms. So even though IBS is one of these, people may say it's like a throwaway diagnosis, it's really not, because the kind of quality of life issues that people have with IBS are really significant, and patients really need to be helped with this. So there are a few subtypes of IBS, and so there's a constipation predominant. So that's when your stool, like that first column there, stool type 1 and 2, this is the Bristol stool scale. And so you're having kind of stool that looks like pebbles or little rocks. And so that's the majority of IBS constipation. IBS diarrhea, you would see the second column where your Bristol stool type 6 or 7, basically very watery, very loose. You can also have IBS with mixed, where it's got kind of a combination of both. And then there's a unclassified as well. I actually haven't seen as much of that. And so how do you diagnose IBS? So you have to fulfill the Rome criteria. It's a functional disease and often a disease of exclusion. So people end up undergoing a really large comprehensive testing before a diagnosis is made. Oftentimes patients will undergo an upper endoscopy. They'll get blood testing to rule out celiac disease. They'll end up having a colonoscopy with biopsies to rule out colitis. They get SIBO testing, a lot of overlap with these syndromes. And then if all of that comes back negative, then you can tell a patient, okay, you have IBS, and kind of go from there in terms of treatment. And so what do we use to treat IBS? Each patient is individual, so treatment has to be individualized. Unfortunately, there is no silver bullet for IBS. It's a lot of different things to try. So in the short term, you can use a low FODMAPs diet. So FODMAPs are fermentable oligomonosaccharides and polyols. So certain sugars that are present in food, certain sugar alcohols that can interact with the gut bacteria and cause bloating and gas. So the FODMAPs diet is one of these things that people may say, oh, I'm going to be on it for the rest of my life. No, you just are on it for a short term. It was designed to be on for a short term. And then eventually you start introducing things back and trying to figure out your exact triggers. You can also increase your fiber content slowly, like I mentioned. Certain medications, certain low levels of antidepressants like TCAs or SSRIs, certain anticholinergics like medication dicyclamine, over-the-counter remedies, including Miralax or maybe some stimulant laxatives. But I also find that a lot of the offbeat stuff helps with IBS too. So yoga, meditation, acupuncture, regular exercise, making sure you're having your increased water intake. IBS is one of these things where it's a functional disorder. So you may not be able to treat it with kind of the typical treatments. And so being able to control your stress levels may actually be useful in IBS in certain populations. So moving on from that, so chronic diarrhea, I want to discuss really quickly. So this can be caused by infections, and these are infections, like I mentioned, C. diff, bacterial, parasites, viruses, pancreatic disorders. There's been a lot of press lately about pancreatic insufficiency and chronic pancreatitis. IBS can cause chronic diarrhea, IBD, like Crohn's and ulcerative colitis, certain food intolerances. So if you're lactose intolerant or have a fructose intolerance, thyroid disorders, altered immune function, HIV, celiac disease, microscopic colitis. You've had surgery. If you're on chemo, see a lot of patients on chemo who have chronic diarrhea. Certain cancers can cause it, and other medications, like I mentioned before, like metformin and PPIs. So we diagnose this again with stool testing, blood testing, undergoing an upper endoscopy and a colonoscopy. And treatment for chronic diarrhea may include certain antibiotics, diet alterations, whether or not they end up having celiac disease, going gluten-free, if they have a lactose intolerance, making sure that they're lactose-free, and treatment of whatever underlying condition they may have. And then in terms of constipation that's not related to IBS, this is chronic idiopathic constipation, so there's no identifiable cause. And this is characterized by difficult, infrequent, or incomplete bowel movements and affects millions of Americans. And we often treat this with changes in diet, increased water and fiber intake. And we now have actually quite an armamentarium of different medications to use if diet has been optimized, exercise, water, and fiber. And so here, Miralax is what we can get over the counter, but the rest of them are all prescription medications that you may have seen advertised on TV. And so I've had great success in some patients who have real issues with constipation and helping them get their bowels moving again. And so with chronic constipation, especially with the idiopathic version, oftentimes what the case is there's something called dysenergic defecation, or DD, also known as pelvic floor dysfunction. And this occurs when the muscles and the nerves in the pelvic floor don't coordinate together to have a proper bowel movement. So the pelvic floor muscles support our rectum, bladder, or uterus if you have one. And under normal conditions, the nerves and muscles maintain our continence. Certain muscles need to relax and certain muscles need to contract in a coordinated fashion to have a bowel movement. And failure of this process can lead to constipation, incomplete evacuation, fecal and urinary incontinence. And oftentimes patients have to manipulate in order to have a bowel move, use manual manipulation to have a bowel movement. And causes include childbirth, any type of trauma or surgery in the area, or frequent straining, sitting on the toilet and just trying to strain for hours on end. And so diagnosis and treatment of pelvic floor dysfunction, we use colonoscopy just to make sure that there's nothing more serious going on, such as an obstructive cancer, and anorectal manometry testing. So this is muscle testing that we do in the rectum to figure out what if the muscles are acting in a normal way and allowing you to have a coordinated bowel movement or not. And so this is kind of the lower picture. The top picture kind of shows what colonoscopy is doing. And the second picture is this little balloon that's deflated, inserted into the rectum and inflated. And then the patient undergoes a series of maneuvers to figure out what the muscle pressures are like. And when they're trying, and kind of simulating a bowel movement to see what happens when they do that. Because oftentimes it'll show that there is pelvic floor dysfunction. And the treatment for that, again, are some of those laxatives like I mentioned, or actually more increasingly is biofeedback therapy. So in our office, we have pelvic floor physical therapists who come in and work with patients to start retraining their pelvic floor. And it's not just Kegels, there are certain ways, which actually is over my head in terms of what they do. They give patients kind of like these little sensors that help them realize when they're doing things right, and kind of gives them positive feedback in terms of the muscle strengthening. And actually that's been proven to be helpful in 80% of cases of patients with pelvic floor dysfunction. So just kind of tying everything together. So what diet and lifestyle changes improve our gut health and motility? So I think diversity of plants. So there is something called the American Gut Project, which started back in, I believe, 2012, and basically is looking at the human gut microbiome. And research has found that the diversity of plants, not only eating more plants, but just increasing the diversity. So increasing 30 diverse plants per week will help you have a more diverse microbiome. Ensuring that your diet is high in fiber or these prebiotics. having a diet that includes fermented foods, such, so including the probiotics, eating mindfully, meaning that when we're sitting down to have our meal, that you're not, super distracted. I know this is obviously very difficult in modern times, but even just taking a few minutes while you're eating, not to shovel food into your mouth, and just be really mindful about how you're doing things, kind of pay attention to your body, use all your senses while you're eating, and seeing, being able to tell when you're full, not overeating. Regular daily exercise, especially out in nature, minimizing animal products and processed or ultra processed foods, ensuring adequate water intake, adequate sleep, and stress management via meditation, again, exposure to nature, and yoga. So tying it together, all of these things, the healthy diet and lifestyle, good gut health leads to a healthy microbiome and good gut motility. So that's it for me. Thank you so much. And we can open it up for questions.
So that was wonderful. Thank you, Supriya. That was really a whirlwind overview, and I learned a lot. So hopefully everybody enjoyed it. And there are a number of questions. I just want to say how wonderful your last couple slides were, kind of integrating together the healthy lifestyle effect on your gut, because I think that's a common message that we've heard here. And we've been talking about how all these things have influence on your cardiovascular system. And we talk a lot about the heart-brain connection. And I think the fact that you make the connection between the lifestyle and our gut, and how the gut and the GI tract are also, and the brain are also connected. And I think it's clear that whole health and cardiovascular health is clearly tied to the gut as well. So thank you for that overview.
Yeah, we could do like a 1 hour lecture on each of these specific topics on their own. So I know that was quite a bit, but there's a lot out there, and trying to distill it into 40 minutes.
No, I think you did a wonderful job. There are a number of questions to just go back to the specific foods that you're really recommending for good gut bacteria. So maybe that's a nice place for us to just recap again. You can review some of that with us.
So the foods, again, so I would say, and again, this is not me trying to say people should be vegan or everyone should be vegetarian. I'm not saying that. Everyone has different food likes and dislikes. Culture is a big part of it. Your customs and traditions that you have in your family are a big part of it. So I'm very sensitive to that. But that being said, I think we've shown in many studies that the Western diet is not healthy, right? And so and if you eat a very meat-heavy diet, if you can at least start making some small changes in, once or twice a week, going meatless, increasing the diversity of plants in your meals. So so for example, if you say, I think I eat healthy, I eat chicken and broccoli for my meal every single dinner or something like that, you need to start thinking about increasing the different types of plants in your diet. So again, a diet that's high in fiber. So any vegetables, fruits, whole grains. So when you think everyone's saying, everyone kind of demonizes carbs, which I think is unfortunate in the sense that, yes, refined carbohydrates are bad for you because they have a lot of other stuff in them that is unnecessary, but whole carbohydrates. So if you're thinking about kind of the ancient grains, quinoa, millet, amaranth, oats are great for you, barley, any of these whole grains that are there, sweet potatoes, even potatoes in kind of a limited fashion are also good for you. So I think that to say all carbs are bad for you is not correct, but I think the whole grains are good for you definitely in small amounts. And then kind of plant-based proteins. So whether that's in the form of lentils, legumes, tofu, tempeh, all of those are healthy. And then making sure that you're getting enough water. I think all of this. So all I'm trying to say is basically you don't need to stop eating meat in the sense that I'm not going to tell you to become a vegan, but I do think it's really important that you increase the number of plants in your diet.
That is wonderful advice. And I think I am a creature of habit. So I will take your advice to heart and try to think outside the box for what I can be cooking for my family this week, because I think we do sometimes pick maybe 5 vegetables, and those are the the vegetables that we gravitate to. And I think that message of diversity, right? Like mixing it up is probably an important one.
It's important. I think that, and especially when everyone says, oh, kids are picky, I feel I'm worried about what my kids will like. I think we sell our kids short, and our kids are actually a lot more adventurous than we think. And so if we expose them at a young age to different vegetables and fruits, and we involve them in the process, I think you'll be surprised at what they'll like.
Yeah, I think that's, it's good to challenge your system no matter what age you are. Yeah. There seem to be a number of questions that are maybe going back to a little bit that you touched on, and the difference between, you know, the dairy and the meat and some of the prebiotics versus probiotics. Do you want to just maybe summarize that again for us?
Yeah, so this is hard because everyone loves yogurt. And so, you know, when you're thinking about dairy, you know, again, it's animal-based protein. It's not the healthiest for you. But a lot of people like to eat yogurt. There's a lot of non-dairy yogurt out there, which is kind of so-so in terms of like the taste, but it's healthier than dairy yogurt, I would say. But prebiotics are foods that are high in fiber. And so these include garlic, onions, leeks, artichokes, basically where you're getting that both soluble and insoluble fiber. Probiotics are the bacteria that are found. So again, like when you think of a probiotic, everyone thinks about it in a pill form, but regardless, it's the bacteria that's helpful for you in your gut. And you can find it in fermented foods. So like some of the foods that I showed on one of the slides, it was like kimchi, miso, tempeh, sourdough bread, like some of these, you know, are probiotic rich foods. And so it's better to, I think, to get it from the foods than from a pill. So prebiotics are high fiber, basically the food that our gut uses to make the short chain fatty acids. Probiotics are those bacteria that make the short chain fatty acids, and they can be present in either supplement or food form. And then so was there a question about meat? Sorry, I wasn't sure what that.
Well, no, I just think that you did a nice overview, because I think the question always is, you know, do we need to modify what we're recommending to patients if they really are a vegan or a vegetarian and avoiding animal products? And then for our patients that have really elevated cholesterol, and we know that they are absorbing a lot of cholesterol from their diet, we try to limit, you know, the amount of animal protein or animal fat that they're being exposed to. So
I will speak from experience. So I'm almost vegan, I would say. I'm not quite there because I love yogurt. And so it's one of these things where that's the hardest part for me to give up. But I don't think that if you have a vegan who's in your office who's coming in, I don't think, as long as they are getting, so protein is not the issue here, because unless you are a super elite athlete training for the Olympics, everyone gets enough protein in their diet. Actually, we get more than enough protein, and no one in this country has protein malnutrition. I mean, you would know if you had it. You see these specific patient populations who have it. So no one really has protein malnutrition in this country. What everyone has is a fiber deficiency. Only 3% of the population actually gets the amount of fiber that is required in the diet. In our diet, it is, you know, or for us, we should be getting at least 25 to 35 grams of fiber a day. We get a paltry 10 max. So we really need to be working on the amount of fiber in our diet. So what I would say is, if you are vegan or vegetarian, more than likely you're getting enough protein. I'm not overly concerned. Some people are worried about vitamin B12 in vegans because you find that mainly in animal sources, B12, but actually nutritional yeast has a good source of B12. And we're actually starting to see B12 deficiency in meat eaters as well, depending on the kind of meat that they eat. If it's very antibiotic, has a lot of antibiotics in it, the B12 is gone. So I think, you know, B12 is one of these things where you should be checking, as a cardiologist or a general practitioner, you should be checking and making sure of it. But in general, I think protein is not an issue. If you have patients who have high cholesterol, we know that red meat and processed meats are based on, from the American Cancer Society, are great, or the WHO are great as class 1 carcinogens. So I think for sure we should be minimizing those in our diet.
That's a nice overview and a nice, again, plug to increase the vegetables. So, I mean, I think the plant-based approach, where we're really trying to eat as many fresh vegetables as possible and supplement in the lean protein, I think is a nice message to all of us. Supriya, we also have Catherine joining us, who's a medical student working with our office.
Hi.
Catherine, did you want to field some of these questions to Dr. Rao?
I was curious about Audrey Cohen's question, flipping back to the fatty acids that were produced.
Sorry, I don't know. I don't have my chat up. What was her question?
Oh, she was just asking, what were those 3 fatty acids again?
Sorry.
And if you could elaborate on them a little bit.
Yeah, should I go back to that slide? Sorry. Oh, here we go. So acetate, propionate, and butyrate. So these are the compounds that are created. Sorry, am I frozen? Am I okay? Shoot, I think I froze.
Oh, we can hear you, but your picture's frozen. There we go.
Oh, okay, all right, okay. Sorry about that. So these are the short chain fatty acids, so acetate, propionate, and butyrate. And so these are the compounds that are produced when the probiotics in our gut, so the helpful strains, so that includes like the lactobacillus, the Faecalibacter, Prevotella, and Bifidobacter strains in our bacteria. There are a lot more of them, but these are just kind of 4 common ones. So when they see the prebiotic fiber that's coming down the pipeline, so when you're eating your onions and artichokes and whatnot, and it's coming down the pipeline, they interact, the bacteria kind of fix onto that prebiotic, and then one of the substances that comes out are these short chain fatty acids. So specifically acetate and propionate and butyrate are kind of 95% of what is produced in the body. And so butyrate has been shown to have these kind of anti-carcinogenic effects, specifically against colon cancer. These 3 are the major energy source for the colon cancer lining. So it helps with maintaining the integrity of the lining, ensuring that endotoxins don't get released. The way it does that is that actually affects the genes that are express the tight junctions. This is getting a little like basic sciencey, but the tight junctions that hold cells together are expressed higher when these are secreted. So it doesn't allow endotoxins to get through, and what's kind of known as leaky gut, it prevents that. It promotes intestinal motility. And then I think, you know, the data that's there for blood sugar regulation and, you know, cholesterol, I think there needs to be a little bit more, but there have been some small studies showing that the interactions they have been positive. But definitely when it comes to vascular inflammation with atherosclerosis, so you're again limiting that endotoxin release and preventing kind of just whole body inflammation.
And I'll just, you know, again, reiterate that from a cardiovascular standpoint, as we have promoted the Mediterranean diet and have worked to get the blood pressure under control, the blood sugar under control, not only have we seen a decrease in cardiovascular events, but we've seen a decrease in all cancer events and also preserved cognitive function, right? Which is not what the cardiologists were looking for, but it just shows how all of our systems are really interconnected.
Right. So
Yeah.
I think with the cognitive function, there has been now studies showing that this whole brain-gut axis is really there. And so you know, the short chain fatty acids, there are studies now looking into Alzheimer's and Parkinson's to show the effects there as well.
So we've really been talking a lot about exercise too, and the effects, especially on our immune system, as well as our cardiovascular system, as we're kind of all dealing with stress levels that are different than what we've dealt with in the past. Have any words of advice for stress management or exercise and how that affects our gut as well?
So I made a couple extra slides here. So when it comes to stress, and actually my Instagram post today is about this because I was feeling it a little bit. So there are about 500 million nerves in our gut that send feedback to our brain. And so the gut releases all these neurotransmitters, hormones, signaling molecules. And so specific neurotransmitters like serotonin and dopamine play a really powerful role in our mood, our energy level, and our motivation. And so actually 90% of the serotonin produced in the body is produced in the gut, and 50% of dopamine that's produced in the body is produced in the gut. And so having a healthy microbiome can extend its influence across the blood-brain barrier, keeping our mind sharp, our energy levels high, improving our mood. Damage to the microbiome, there have been some studies that have associated with Alzheimer's and Parkinson's, and kind of like overlap with IBS and depression. If you have an alteration in gut bacteria, you can alter your serotonin levels, which then alters your mood and motility. So this is kind of where I feel like there's a lot of overlap between kind of IBS and having this like stress anxiety kind of constellation in those patients. And you also get something called increased visceral hypersensitivity. So even though your gut may look fine, your nerve endings are just that much more sensitive and causing pain. And so I think when it comes to stress and mood, right now, I think the main thing to do is just self-care. And so ensuring that you're doing some type of like 5 to 10 minutes of meditation or mindfulness practice every day, I think kind of helps reset your intention for the day and really helps with kind of calming things down. I think also exercise is really important. So like overall fitness contributes to gut fitness. And so there have been studies in rats that have shown that increased exercise increases short chain fatty acid production. And this was done like this study was actually done several years ago. Other studies have shown that women that went into moderate exercise 3 times a week, whether it was a brisk walk or swim, that also increases certain strains of helpful bacteria. And athletes have a different microbiome compared to sedentary individuals of a similar age and gender, more diverse, higher abundance of helpful strains. And so I think with exercise, it's there. I would say it's there, but it's hard to separate diet from exercise, because if you think about an athlete, they're probably eating a little bit healthier than the general population. So there are some confounders, I think, in that. But overall, exercise does improve your motility, it aids in digestion. So, and it's good for overall cardiovascular health. So you should do it. And also with your stress levels as well, getting those under control, which I know is super hard given the current state of affairs. But whatever you can do, meditation, mindfulness, I think is helpful.
And just another plug, right, for us to really be self-medicating with exercise, because I think it might be natural to self-medicate with sugar or things that we gravitate to in our diet that maybe shouldn't be the healthy things that we're choosing, right? And then it's almost like a double whammy to our system, right? Because
agreed. Like sugar is one of these things too, and it's very understandable why it does, because sugar kind of plays into our hedonistic system in our brain, the amygdala, and so it kind of hits these receptors in our brain, these kind of low-level receptors that, you know, certain drugs actually hit. So like heroin and whatnot, they hit them much harder, but sugar at a much lower level does. And so you get this kind of euphoric sensation by eating sugar, and then in order for you to reach that same level, you need a little bit more, you need a little bit more. And so it kind of is this vicious cycle with sugar. And like, I hate to use the word addiction, but it almost is in a sense of like a double whammy, because not only are you now giving your body something that it doesn't need, it wants it even more. And so you're kind of you get stuck in this rut with sugar, I think. And so getting out of it can be really hard, but being able to break that habit is important.
Supriya, can you go back one slide? Because I'm so interested in the relationship between diet and mood. And are there different foods that cause release of serotonin or dopamine in different amounts that would, unlike sugar, affect your mood in a positive way?
Right. So I think, again, like the research in this is still ongoing, but it's basically the foods that we've been talking about, high fiber diet.
Would cause release of serotonin?
Yeah. Yeah.
Okay.
Yeah. So increase in the short chain fatty acids. I don't know the exact mechanism to be truthful, but it does help with kind of modulating serotonin release in a greater fashion than if you were eating kind of like the usual regular Western diet.
It makes sense. So interesting. So someone's asking whether there's a book people could read, or a resource that you have.
Sure. There are a few actually. One of them, I just need to remember his name. Hold on one second. I can look it up really fast. There is a book called The Blue Zones, which you can look up. There is a book called How Not to Die. That's by Michael Greger. One of my friends actually just wrote a book called Fiber Fueled. His name is Will Bolshewitz. He's a gastroenterologist in South Carolina. So those are kind of 3 books that I would look into. There's also Jason Fung wrote a book called The Obesity Code, which I think a lot of people had read. And that kind of talks about intermittent fasting, which is a whole other lecture, which I think you may have had some lectures on intermittent fasting already.
Thank you. Yeah, we'll put these resources on the website. And another question, so acid in the stomach is perhaps our best friend and our worst enemy at the same time.
Yes.
As a result, as you pointed out, PPIs like Nexium, Prilosec, the purple pill, are so overprescribed perhaps in the world for every type of heart.
Right.
It's very hard for people to come off it, even though perhaps the initial intent was 6 to 12 weeks, settle things down, come off it. People are on these for years, if not decades.
Right.
Do you have advice for people when they feel they might be ready to come off a PPI something or a with proton pump inhibitor, these very powerful acid blockers, how they can do that without having rebound heartburn?
Right. So the reason, like you said, to put someone on is if I do an endoscopy and I see inflammation in the esophagus, I want to put them on a PPI to ensure that they don't eventually end up getting Barrett's esophagus or further down the line esophageal cancer. So it's important. PPIs play a very important role in my day-to-day patient life. But like you said, I think a lot of people stay on PPIs because either they were never told to come off of it or they just got used to it. And if they do come off of it, they have a lot of rebound symptoms. So what I tell patients is to try and really look at your lifestyle. When are you eating? Are you eating at 10 o'clock at night and then going to bed at 11 o'clock? I recommend that people finish eating by 6:30. It sounds really early and it sounds not that fun, but it honestly is one of the things that is really going to help the acid reflux symptoms, especially during the night. If you finish eating by 6:30, go for a walk, aid in your digestion, and eventually go to bed by like 9:30, 10 o'clock, your stomach should technically, if you have normal motility, should be empty. And so you really shouldn't have much of the acid issues. If you are overweight, losing 10% of your body weight improves acid reflux immensely. Like really, it really does. If you have something like a hiatal hernia where basically the integrity of the lower esophageal sphincter, or basically where your esophagus meets the stomach, if that integrity is lost, unfortunately, there's not really much to be done if you have acid reflux there, unless you end up getting an endoscopic procedure like a fundoplication to kind of restore that integrity. So we have a lot of patients here who don't want to be on a medication anymore, and for good reason. And so we tell them, okay, we'll just confirm again that you have it. And then we do a procedure here called, basically it's an endoscopic fundoplication, where we go down with the scope, wrap the top part of the stomach around the bottom part of the esophagus, and patients are able to come off their PPIs that way. But again, there are some patients who need to stay on PPIs. If you have Barrett's esophagus, that would be a condition. But I do think you're right. They are overprescribed. They do have a place, but they are overprescribed. But a lot of times, like discussing lifestyle with patients, I think we need to be more open to discussing that, because that in and of itself is going to be the main way to help with some of these symptoms.
Thank you. Great.
Well, that was wonderful and such a nice note for us to end on, because I think the lifestyle piece is something that we really believe here at Lown and really try to promote. And sometimes that is much harder than prescribing a specific medication to really get at the root cause and try to kind of heal the problem and everything else that's gone wrong from there. So so we've all really learned a lot. Thank you very much. I'm sorry that there are no applause in this.
That's okay.
In our world, we're all getting used to it, but I think we can see from the number of people participating in the Q&A and the chat with questions that that this has been a wonderful discussion. So we'll put the answers to a few more of these questions and the book recommendations in the follow-up survey, and ask that everybody also submit the review as well. And Supriya, thank you so much. This has been—
Thank you very much. This is wonderful. Thanks for having me.